What's up, everyone? It's Russo. I hope everyone is doing well. Please follow my Instagram at RussoLifts, just in case something happens to this YouTube channel. You can follow, message, and you can watch my daily story content on Instagram. I'll see you there. What's up, everyone? It's Russo. I hope everyone is doing well. I just want to apologize for the hiatus. I've been restructuring my whole work schedule, so I have more time allotted to video editing. Video editing takes up a lot of time, and I just have too much going on, too many things coming at me at once, but really going to get back into it. But I have been active on Instagram, so follow me at RussoLifts for more, content that's consistent. But I wanted to bring up this topic because I just got done with a consultation call with one of my subscribers, and just want to bring this topic to light about this weird thing endocrinologists do. So the consultation call, my subscriber was from Sweden. If you don't know the laws in Sweden, they can essentially arrest you for looking too juiced. Like, if I went to lift in Sweden, like, I could get like put in handcuffs in the gym for looking too saucy and just drug tested right on the spot. That's how they're like with steroids and anabolics in general. And there is an underground steroid scene in Sweden too. Like, this doesn't stop anything. But, underground steroids and hormone replacement therapy are two different things, right? Hormone replacement therapy, people need testosterone, in my opinion. And, I have my own company, Elevate Alternative. I know the night and day difference. People write me, thank you so much. I no longer am anxious. So, it makes a giant difference in quality of life just to use testosterone to have normal, consistent levels versus being crashed all the time. But anyways, my subscriber, he was going through all the legal procedures to get his hormone replacement therapy. This is not to get jacked up. This is not to get juiced up. Literally just normal hormone replacement therapy. The hoops he had to jump through were crazy. He was telling me all of them. So he had to do all these different appointments that he had to wait a long time for. This is all while his testosterone was really low. And then he finally got approved. And this is where the issue came in. This is why the consultation call essentially happened, is because basically, if your endocrinologist is doing this, you need to switch to a different method. But he would get one shot, I forget the ester, but one shot every 4 weeks. And he said by week 3, his anxiety was all over the place. So this is a common thing that these endocrinologists are doing, and I'm not sure as to why. My guess from a clinical standpoint, maybe to have, estrogen not get too out of control where you'd have to use an AI. But basically what's happening is he started his hormone replacement therapy. He's like, yes, I'm finally going to feel better again. And, I'm going to have my normal quality of life back. I'm not going to feel tired all day. I'm not going to feel down all day. I'm just trying to optimize my hormones, right? He's not trying to be a bodybuilder here. So first week, he would get his shot. By week 3, it's down here, right? So an ester just tapers off down. It's not like a constant thing. It just tapers off. So the longer ester you use, propionate tapers off in like a day. And enthate tapers off in 7 days, 6 days for cypionate, and undecanoate's a couple more days after that. But basically, it's a slow downward dip, right? Still a constant level, but a slow downward dip. So by the time you got to week 3, he started here, he's probably down here. So mentally, he feels great. Boom, by week 3, he's like, really needing his next shot. And he was stuck in this loop. And he was asking me if that anxiety was normal and, what the deal was with this TRT thing. And yeah, I just want to bring this up. If this is going on with you, absolutely stop. He obviously figured it out. He just wanted to confirm with me on, what he should do. Now he's having to self-administer underground TRT, which is ridiculous, right? I think an endocrinologist should be able to listen to his or her patient's symptoms, what they're experiencing, maybe even pull blood levels on week 3 versus the week 1 of the shot and seeing how far it's dipping off, and then adjusting the protocol to see fit. I don't know why this is still going on, but this is a big problem because number one, it's going to turn a lot of people away from TRT because they're going to feel fucking worse with TRT. And number two, it's just a horrible mental roller coaster of constantly having that, like, boom, I got my shot, now dip, 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 versus just keeping it consistent. 2 shots a week, stable levels, feel fine. No amount of cortisol, nothing is going to affect those levels, which is the whole point of TRT, right? All the outside forces that bring down natural testosterone with exogenous TRT or HRT, you have a constant level, so you're not worrying about your hormone levels based off stress. When you do this once every 4-week shot, it's just like defeating the whole purpose of HRT or TRT for a mental health standpoint. In fact, it's making it worse. So I just want to jump on video and talk about this. If your endocrinologist is having you do some sort of protocol like this, absolutely stop. Absolutely talk to him about wanting to maintain more stable levels and seeing what they can do from there. Obviously, if you want to support my TRT company, check out Elevate Alternative. They are super knowledgeable and they will not have you be doing a once every 4-week shot, right? You will have a constant supply, 2 shots a week, normal stable levels, and you have options to get other things on top. It's not going to be like this little bit of testosterone because the endocrinologist doesn't know what's going on or is afraid or whatever. I don't know the reason why you would give someone a shot every 4 weeks when you know by the end of week 3 they're at like 0 essentially. So yeah, just wanted to bring this topic to light. I really don't want to see other people suffer through that continuous cycle because that will take a toll on your mental health for sure. And I think if you're not educated and you think the endocrinologist knows everything, then you might not ever question it. But always look into what the endocrinologist is doing. Always look into everything else for yourself before trusting someone, including me. But yeah, I just wanted to bring that to light. I hope everyone is well, and I'm going to get back on the high horse on YouTube. I appreciate everyone. Hope all is well.